She was living through a parent's absolute worst nightmare. Her sorrow was immense, and beyond anything a prescription or my words could heal. Kay and his mother are two of the biggest reasons I committed my career to HIV, and their memory fuels my work every day. So today, as we honor progress and strengthen community, their memory and the memory of so many others calls us to move forward with purpose and compassion. The world of HIV looks profoundly different from the one that it did 44 years ago when the first HIV cases were diagnosed. That transformation is the result of relentless advocacy, science, resilience, and love. I am proud to work with all of you in this room and those in the community on the journey to end the HIV epidemic in Philadelphia. So today is about honoring progress. So Philadelphia has a bold goal to end the HIV epidemic by 2030. That means reducing new HIV diagnoses to 47 or fewer each year. We are not there yet, but diagnoses have decreased since 2019 by 14% and have held steady at 385 in 2024. And that stability is not a stall. It's a foundation where we will build on together. As I said, today is also about strengthening community through action. So things that the health department and the Division of HIV Health are doing are expanding HIV testing. So we are doing that so more people know their status, and we're making progress. Over 2,000 HIV self-test kits were distributed in 2024 through the mail or community partners, the most since the program began pre-pandemic. And we're doing more. HIV self-test kits are now available in our Philly Keep on Loving public health vending machines located in community-based agencies and in the Philadelphia Department of Prison waiting rooms. These machines carry other health supplies such as pregnancy tests, COVID-19 tests, fentanyl test strips, and naloxone, among other items. These machines allow us to bring health supplies to the communities most impacted by HIV and bringing screening directly to where people already are. We're working to advance treatment. We are treating HIV rapidly and effectively so that people living with HIV can live long, healthy lives and cannot pass HIV to their sexual partners when undetectable. And we're making progress. Nearly 80% of people in care over the past 5 years were virally suppressed, approaching our 2025 target. And we're doing more. We now have citywide standards of linking and starting people with HIV on HIV treatment within 4 days of their first positive HIV test. As of 2025, 8 out of 10 individuals receiving care in our Ryan Grant system who were newly diagnosed with HIV linked to HIV treatment within 4 days of their initial reactive test. And really, we know that early treatment improves outcomes, helps people get into undetectable faster, and prevents onward transmission, and we're making progress. This is all good news. We're expanding prevention access. We're preventing HIV by making PrEP, pre-exposure prophylaxis, and PEP, post-exposure prophylaxis, more accessible than ever. And we're making progress. PrEP coverage has surpassed, in Philadelphia, has surpassed the 2025 goal of greater than 50% of people with an indication for PrEP taking it. And we're doing more. The Philadelphia Department of Public Health TelePrep program and PEP Center of Excellence ensure quicker, easier access to PrEP and PEP. Philadelphians can start PrEP in the privacy of their own home and at no cost through phillykeeponloving.com. And for those who need emergency prevention after exposure, Philly's 24/7 PEP hotline is there anytime, any day. We're also working by eliminating disparities. And the health department is committed to reducing these disparities driven by racism, discrimination, stigma, and the inequities faced by people who use drugs, exchange sex, or identify across the spectrum of sexual and gender identities. Disparities are unacceptable, and visible healing requires us to address them head-on. Healing must be felt in every neighborhood, every clinic, every community space, person living with or affected by HIV. And today is about moving forward together. Today, I ask of you to pause and remember why you are here. Maybe it's a friend, a partner, a family member, a patient, a client, someone whose life touched yours, and hold their memory close. And then commit, truly commit, to one new action this year that will help us end the HIV epidemic. The health department cannot end the epidemic alone. No single organization can, but together, as a community visibly healing, honoring our progress, and standing shoulder to shoulder, we will move forward. And finally, let us reaffirm our commitment to fostering a safe, respectful, and equitable environment for every person by addressing the harms created by racism, discrimination, and bias in all their forms. Advancing equity requires each of us working together to support the health, dignity, and well-being of our entire community. And thank you for your strength, your partnership, and your belief that the future can be different. Together we are healing, together we are moving forward, and together we will end the HIV epidemic in Philadelphia. And thank you very much. And I'd like to introduce our honored guest today, Dr. Khaled Raval Nelson, the Commissioner of Health for the Philadelphia Department of Public Health.